Welcome, Franz.
Hello, Christine.
Yeah, it's good to see you here in Oslo again. Yeah,
it's a pleasure.
And these 2 days has been a fantastic, advanced international course.
Thank you.
And this time I would let us focus this video on trauma and mental health.
Mm-hmm.
Franz, in one of your lectures, you actually mentioned that there is no such thing as mental illness.
Mm-hmm.
That the types of mental illness and states like depression, ADHD, bipolar, OCD, autism, or asperger, or schizophrenia are just labels given by the psychiatry professionals. They are just consequences of trauma or multi-generational psychotrauma. So can you explain briefly on how can a past generation trauma from a previous generation affect the mental health of the next generation?
Yeah, for me, in my experience, the key trauma is the trauma of love, what I call. I give this name to this trauma, this type of trauma, call it the trauma of love, because all starts with the relationship we have to our first partner, relationship partner, and this is always the mother, because this relationship starts already before birth. And so, if it's a good relationship, and you can develop your own identity, you can develop your whole organism, whole body in this context very well, then there's, in the end, you can say, no problem. But if in this first relationship you have with your mother are traumatic events involved, that means your mother is not available for you, maybe she suffers from violence, or maybe she does something not to accept you or to reject you, then this means for the child that you are not welcomed, that you wanted, that you are not on the emotional level accepted. And this is the reason why then the child has to split in order to survive themselves and in order to stay in the relationship with the mother.
Okay.
This causes, the more the mother is traumatized, it forces the child to split in many parts. We have seen some constellations today, how this works. So that the child is not able to connect with the own identity, but to fulfill what is expected in this relationship. And this is my experience. This is the basis, this splitting is the basis for all this what in the psychiatric world then is called the depression, the bipolar, or even panic disorder, schizophrenia, borderline, whatever.
Okay. So how many generations will be affected?
If the trauma doesn't stop, every generation, the following generation, in a way is affected. And so you can say the whole human, all the human beings living here, as long as they are part of the trauma, then this will be passed on to the next generation. So the only reasonable thing we can say, stop it in this generation where you are. And if you are parents and you have young children, small children, then you can do a lot by working on yourself, looking at your own trauma, integrating your trauma, being your true self, living your true self. That helps a lot for the following generation.
So would there be a possibility where the problem may maybe skip one generation and then the next generation got some of this mental illness?
What you can observe that children can also be symbiotically entangled with the generation of the grandparents. That mostly they do have contact with physical contact with the grandparents. So it can be that they are, because there's a trauma of love in relation to the mother, then they also go into the trauma of the
grandparents,
especially the grandmother.
Yeah, especially in the older generations when they have gone through war, there may be some, bad things that may have happened in the previous generation. So is healing possible for these mental illnesses, disorder?
So to repeat it, I do not call them mental illnesses. This is a
state. It's just a consequence.
No, this is theory. Mental illness is a theory. A theory that is made by psychiatric person, people working in these fields, and I have a different naming for it, because for me these all are consequences of this splitting and split off your eye, and instead developing as surrogate eye. So then what does healing mean? It means that you first come into contact with your healthy eye, and from this position you can integrate what was split off, you can soften down your surrogate surviving strategies. And though this is a different concept, of course, because if you have the concept of illness, then you try to do the illness away. For example, giving medications in order to take the illness away. The illness away, that means to take the symptoms away. But this is not the way I'm thinking. It's because the symptoms, they are part of you. They part maybe of to show your survival strategies, or show even your traumatized part. It doesn't make sense to make something away, but it makes, in my theory, it makes sense to take it all in, and give it the place. And this you can only do when you are in your healthy eye, and you can grow. The healthy eye grows as much that you can take all that in what belongs to your identity, because it's your way, the way how you lived from the very beginning. So this is a completely different thinking. Thinking about illnesses, or talking about the consequences of the trauma of love.
So through your experience after having been doing this work for the last 20 years, and you look around at the rest of the methods that are available out there, would this method of yours, named as a COSI, constellation of the sentence of intention, is this the only method so far that is effectively being able to bring us to come into contact with the eye, to find back what happened to...
Yes, of course I can't say that this is the only method, because there are so many methods, and even I only maybe 5% of those methods are available and are developed, I only know. But I can say that I focus on the eye more and more. I focus on this, what is I call the eye, or what is our identity, and then with the constellation of the sentence of the intention, you can see in what state this eye is, how much you really, your identity, or how much you did split off from that. And then with this method you can integrate, and this, then it shows that also this, what is called mental illness symptoms, they find their place, or they are no longer necessary, because then you act out from your healthy eye, not from a surrogate eye. Surviving strategies.
So, so how about those who are clinically diagnosed with a chronic condition and maybe already institutionalized? Can this method help? Can COSI help?
Of course. If somebody...
Even when they are still taking medication heavily?
But what is necessary is that you do have an intention.
They must be in a state.
They must
conscious
be
enough to have an intention.
They must be in a state where they can have an intention, and then they maybe see the limitations that are done by medications, or they see maybe the surviving strategies that rely on not seeing the trauma, but avoiding to come into contact with the reality and truth. That depends. But if somebody wants to go this way, and he finds somebody who is expert in working with the constellation of the center of intention, then
and that is if you find somebody who is expert in there, working on the method. So you would say that for those who are not in an institution, for example, clients who are on the suppressant, antidepressant drugs, even if their senses numb and they have the ability to come up with an intention, it can still work.
You have to start. The first thing is that they have to start, and they have to learn what do the medications do with me, for example. Then maybe after a while you see they do not help you really to integrate, and then you can decide step by step. To decide, okay, I rely more on myself, on my healthy I, instead of dissociating and relying on the medication.
Okay. So, so for those who are maybe autistic, for example, autistic or asperger, suffering from asperger syndromes, can they also do? That's if they
have an intention.
Yes.
Yeah,
yes.
They have an intention, and within the limitation maybe of what already has developed within their psychological structure, the brain structure, then they can come as far as possible.
They can still do? Okay.
Yeah, they can.
Would there be any risk or implication on their... No? Okay.
No. It's just as long as we, as therapists, we are really focusing on the intention and don't go too far,
of course.
more and bring up stuff that the client cannot deal with it in the moment, that there is no risk.
Yeah. Okay.
So it's up to us as a therapist that we follow strictly the sentence of the intention.
Yes, of course.
And then we are on a safe place.
Right.
That's my experience.
Okay.
That I actually can say.
Okay. So how about young children suffering from any of the mentioned conditions like ADHD, bipolar, OCD? You know? Can they also do, or can the parents not do and just the children do, or?
The first thing is how old the children are.
Yeah, younger, let's say less than 10.
Yes, if they are very young, that is always the most helpful thing. First, the parents go and do something, then the children can relax, because the trauma of love means you have to adopt to a traumatized mother or father.
Yeah.
And if the mother is no longer traumatized, then the children are free. And they can freely develop. Maybe there is something to do about the sadness, but then it's much easier. But as long as you make therapy with a child that is still dependent on the parents that are traumatized, what can the child do? The child has to adapt to this situation. And that makes, in a way, the child a little confused. And this will result in that the child do not want to make therapy. They withdraw from therapy. They go in the opposition.
So what is your advice to mental health professionals and parents and caretakers who actually find it hard to accept that unresolved psychotrauma is the root of all these psychological difficulties?
I think the only way is to look at yourself, first of all. And all of us have the go this way and work in this way. If we do not look at ourselves and look at our own trauma and see that in our own development, the trauma of love was there, maybe the trauma of sexuality, the trauma of violence, only then, when you are really looking at yourself and see the advantages you have, then of course you can offer it to others. You can't do it only just by using a method, any method, or just doing out of the head and mind, and just on a professional way. The personal experience is the basis that you really can offer this way of working. Otherwise, it doesn't make sense.
Okay. Thank you, Franz. Thank you very much for your time. Okay. And for any one of you who has anyone in your family or friends who are suffering from any mental disorder or illness or having similar, mental states and struggling with it, like what Franz said, is just a consequence of trauma. So be curious about it. Contact us at the link below for more information on how you can come for therapy and come for lectures to understand more about Franz Ruppert's work. Thank you very much. Thank you.